This presentation is designed and delivered by the BC Renal. In this presentation, you will learn about the choices you have when your kidneys stop functioning. It is important that you understand all of your options so that you can make the choice that is best for you. Let's get started. Kidneys are vital to our overall health and well-being. Healthy kidneys work to clean our blood by filtering out waste byproducts. Kidney failure leads to serious health complications. There are a number of treatment options for people whose kidneys are failing, and it is important that you understand all of your options so that you, supported by your kidney care team, can make the best choice for your situation. This chart shows the different levels of kidney function. You might already have some test results showing your GFR or the current level of your kidney function. If you know your GFR, you should be able to see where you fit on the chart. If you don't remember your GFR, you may be able to find it in your test results. Or you can ask your healthcare provider. Most people who are learning about their kidney replacement options are at the 15 to 29 level of GFR, shown by the orange box. When making a decision about your treatment options, it's best to think about what is important to you. There are a lot of things to consider. Here are just a few. Is it important for you to be in control of your time? Do you tend to do similar things every day, or does your daily schedule change a lot? Are you an independent person? Do you like doing things yourself, or do you prefer to have things done for you? Do you have a lot of activities in your day that are important to you? For example, work, volunteering, or family commitments? Would having a diet that restricts what you eat and drink be okay for you, or would you find that difficult? Are you an active person, or do you have a calmer, stay-at-home lifestyle? These are just some of the questions to think about as you learn about the different options. They can help you decide which option might be the best fit for you. We are now going to look at the various treatment options. Most people with kidney failure will require more than one type of treatment over their lives, so it's good to know about all the options. And sometimes the option you think you would like changes once you learn more about the others. Or your healthcare team might suggest an option that could be better for you and your situation. It's best to start by having an open mind. The treatment options available to people going through kidney failure are transplantation, peritoneal dialysis, hemodialysis, including home-based and clinic-based hemodialysis, and conservative care. This presentation will explain all of these options so that you have the information you need for thinking about which choice might be best for you. Let's start with the option of kidney transplant. Transplant is the preferred choice for most people with kidney failure. A kidney transplant involves getting a healthy kidney from another person, a kidney donor. Surgery is required to place that healthy kidney into your body. This picture shows where the new kidney is placed in the body. Many people are surprised to learn that their own kidneys are left in the body when they get a new kidney. It is also important to understand that transplant is only a treatment for kidney disease and not a cure. That means you will still need to meet regularly with your healthcare team and take medications to make sure your transplanted kidney stays healthy. There are two types of kidney donors, living donors and deceased donors. A living donor is just as it sounds. The kidney comes from someone who is alive and has volunteered to donate one of their kidneys. People can live long and healthy lives with one kidney. Someone who volunteers to donate their kidney will go through many tests to make sure they are healthy and it is safe for them to donate their kidney. In the case of a deceased donor, the kidney comes from someone who has passed away and who agreed to donate a kidney before they died. BC Transplant is the agency that takes care of all kidney transplantation in BC and makes sure that every donated kidney is healthy before it is transplanted. There are a number of advantages to having a kidney transplant from a living donor versus from a deceased donor. Transplants from living donors last longer, have a lower risk of rejection, allow better overall health, can be done before kidney failure. For a deceased donor, you must be on dialysis before you are put onto the wait list. Talk with your kidney care team about finding a living donor and the resources that are available to help you. Even if you are planning to get a kidney transplant, there is a wait time. And if your kidneys fail before your transplant operation can be done, you will have to go onto dialysis for a time. So even if transplant is your preferred choice, you need to consider what type of dialysis you would want if your kidneys fail before your transplant operation can be done. In thinking about your options and coming to a decision, you should think carefully about what is important to you and to the way you like to live. In this section, we will discuss what peritoneal dialysis, or PD, is and how it works. We'll also look at what your PD options are and the benefits and the drawbacks of PD. Let's start by describing PD and what it does. PD is a kind of dialysis that you do at home. It uses a tube called a catheter that goes into your belly or abdomen to remove the toxins from your body. When you start PD, you will learn how to do both daytime and overnight PD. Your PD team will work with you to determine the best schedule for you. There are two types of PD. Continuous ambulatory peritoneal dialysis, or CAPD, is the manual form of PD. Manual PD is usually done 4 to 5 times a day and takes about 30 to 45 minutes each time. Everyone who chooses PD as their dialysis choice starts with manual PD. Continuous cycling peritoneal dialysis, or CCPD, uses a machine. This kind of PD is done at night while you sleep and usually takes 9 to 10 hours. This picture shows a CCPD machine and a woman getting ready to start her machine-based PD session before going to bed. As you might guess from the pictures, one of the benefits of PD is that it allows you to travel, and there are many other benefits associated with PD. Generally, these include increased independence and flexibility. PD helps preserve your remaining kidney function more than hemodialysis, which we will learn about soon. It's also gentle on your body because it works much like a natural kidney. And there are no needles involved in PD, which some people find very appealing. Other things to consider regarding PD include the need for having a catheter tube in your belly. Some people really like to soak in a bath or a hot tub, which should be avoided by people on PD. However, having showers is okay. To start PD, you will need to get some training to make sure you can do it on your own at home. PD has to be done every day, so it needs to be part of your everyday routine. You will also need some space to store the supplies needed for PD.
And I got good advice from the doctors here at the hospital because they told me I really didn't know about it before, and they wanted me to go that way, and I'm glad I did. Most of the time while I'm doing it, I'm asleep, so it's really good that way. Everything's right there for you, and you can set up and do your run for the night, and you just do it. You know, I've just got it down. It's just part of the routine every day. And, you know, maybe I spend 15 minutes hooking up, and then in the morning another 15 minutes to shut it down. Oh, it's a great benefit. I've got lots of energy, and I get up at the same time every day and have a full day. I do it every night and for 8 hours, and everything seems to work pretty well.
It's time now to consider if PD feels like the right option for you. If you started PD, What would be the biggest change for you? What would be the best part or biggest benefit of PD for you? What would worry you the most if you were on PD? Is there anything more you would like to know? If so, write it down to ask someone from your kidney care team later. Hemodialysis, or hemo, is another type of dialysis. In this section, we will learn about hemodialysis, including what it is, what a vascular access is, what the different hemo options are, and the benefits and possible drawbacks of hemo. Hemodialysis uses a machine to remove, clean, and return blood to your body. This can be done in your own home or in a hospital or a community clinic. To do hemodialysis, there needs to be a way to connect your blood vessel to the hemo machine. This can be done through either a fistula or catheter. For most people, a fistula is a better option than a catheter. A fistula is created when a surgeon connects an artery and a vein together. Once the fistula is ready, it becomes a natural part of your body and provides good blood flow and a dialysis connection point that can last for decades. A fistula cannot be used right away. Getting a fistula well before you begin hemodialysis is best, as it takes a while, sometimes many months, for it to be ready for use. A second but generally less preferred way to connect your blood vessel to the hemo machine is through a catheter. A catheter is a Y-shaped plastic tube that goes into a vein in your neck. This type of access is most commonly used in emergency situations. For example, when someone needs to start dialysis before their fistula or graft is ready for use. For most people, a fistula is the best choice because it performs the best, lasts the longest, has fewer complications such as infections, is safe to shower and swim, requires fewer hospitalizations. There are two basic types of hemodialysis, home-based and clinic-based. Home-based hemo can be done at home. You can do it on your own time, so the schedule is up to you and is very flexible. Here is a view of two people on hemodialysis. One is on home-based hemo, the other is in a clinic-based hemo setting. In looking at these pictures, think about the different benefits of each of these two hemo options and which option might work best for you. Home-based hemodialysis allows you to have more control over your schedule than clinic-based dialysis. It may also be gentler on the body because you can do it more often and for longer periods of time. That means you will have more energy and generally feel better. It also means taking fewer drugs, and you can be more flexible in what you eat and drink because your blood is cleaned more often, and it is easier to travel. A support team will be assigned to you if you are doing hemo at home, so you can ask questions and get answers at any time. Before you start home hemo, the Renal program will provide you with detailed training. You will also need hemo supplies. These will be delivered to you and are paid for by the Renal program.
I was doing sort of semi-yearly testing because they found cysts in my kidneys when I was 35 years old. And so it just came to a point where I'd actually delayed doing my testing for quite a while. And then when I went and I was down to 10% kidney function. So it was, quickly, we have to do something. So I went into the program right away. I was scared, for sure, shocked, but I'm kind of the person that just, you have to deal with it, you have to go, you have to move on, right? There's nothing else to do, so you just go forward. I didn't know until the doctor mentioned to me that home dialysis was an option, and I immediately thought that was the way I wanted to go. The first few alarms were pretty scary, and thinking the machine was going to shut down or something was going to happen, and it was the middle of the night and you're sleepy and groggy and everything. But got over that right away too. So now it's kind of a open one eye. Oh, that's nothing. Push the button, back to sleep. My granddaughter was the most curious. Everybody else came in and looked at the machine and went, "Oh wow," but her, she's 6, so she wanted to know everything. What does that button do, and what's that for, and where does water go? And Grandma, blood comes out of you? She was just so curious. So I did have a night where she spent the night, and I hooked up for my run, and she was, a million questions, just couldn't stop herself, And then after I hooked up, laid down, she was asleep in 2 minutes, which is unusual for her, but she was right out. She was just keeping herself awake so she could see exactly what Grandma was doing. I get about 30 hours of dialysis a week, and I feel great. I have tried not to let the kidney failure change much for me, and I don't think it has. It just works so great. I just couldn't do it any other way. I wouldn't be happy. Now, after this experience, there's no way I'd be happy.
When you don't know much about a disease, you fear it because you don't know what the outcome's going to be. I was doing 4 hours at either VGH or a community unit. Just going in, putting your arm out and going, "Give me dialysis," and that's it. I would have to go home and sleep off 3 hours to be able to feel like I would the day before. There was no way on the day that I would have dialysis that I could even work that day. Then they actually approached me and said, "I think this will be a good option for you." Nocturnal dialysis and being independent, doing it at home or on your own, what doctors and nurses allow you to do is to actually take control of the disease. It was a huge turnaround. I come off and I'm actually quite energized, just like I would be going on. So the difference is huge. Now, when my blood work comes through, I'm more inclined to look at it and know what's wrong, what I need to do better to work on and stuff like that. If I want to go out and have a golf game, I'm able to do that without having to take a break. Whereas before, on conventional, there was no way I could even go and walk the course. I almost feel like a regular person that has a working kidney, and doing the more dialysis, that's how you feel. Being able to work and not being under support of the government or anything like that is huge. And then now that I've been doing it for 7 years on my own, it's like pretty much night and day. I needle myself, I set up the machine and do all the stuff on it, so it makes you feel much more in control of the disease, for sure. Even when I go traveling, I'm not going to fear doing dialysis because I already know everything you need to know about dialysis. So that fear just goes away. Doing it yourself is a lot easier and less scary than the unknown. Now it's taking control and controlling the dialysis rather than it controlling you.
The other type of hemodialysis is clinic-based. Some people prefer to have someone else do most of the work of dialysis for them. For them, this is one benefit of clinic-based hemo. In some clinics, you can do dialysis at night while you sleep, so you can have your daytime free. On the other hand, there's little flexibility with clinic-based dialysis. Your dialysis schedule is set, usually for 4 hours, 3 times a week. All of your dialysis is done at the same center. It is harder to travel on clinic-based dialysis than home-based dialysis.
The treatment itself is 4 hours, but generally I'm there 5 hours. When I get there, first thing, I have to weigh. And you write down how much you weigh. You have to take your temperature and write that down so that when the nurse calls you in for your treatment, you can give her the little piece of paper, and that's like part of the work already. The advantages to in-center dialysis is that you can read or you can watch television, you can sleep. You do have a little bit of freedom of what you want to do while you're there for the 4 hours. Tuesday, Thursday, and Saturday I have dialysis, and Monday, Wednesday, and Friday I like to go swimming. My general health is really pretty good. I certainly feel good on days that I swim, and I think it's because of the exercise. On the Tuesday, Thursday, Saturday, I feel okay, but after dialysis, I usually have a sleep.
The final part of this presentation is about conservative care. Conservative care means choosing not to do dialysis and not to have a kidney transplant. If you choose conservative care, you will still get medical care. Your healthcare team will be with you the whole way through. Choosing not to pursue dialysis does not mean that other treatments are not available to you. The focus of care for someone who chooses this option is to reduce the symptoms of their non-functioning kidneys and to make them as comfortable as possible.
My kidneys went right down to 6%. They wanted to put me on dialysis, but that's one thing my family did know, and my doctor, that I said no dialysis. If I get that far gone, I'll take my chances. And at my age, I can't see any sense in it. And even the specialist agrees with me. He says, it might give you another year, or so, but it wouldn't be a quality of life that I would want.
If you would like to know more about conservative care, ask your healthcare team. This presentation is intended to help you understand your treatment options if your kidneys fail. There's a lot of information to consider, and you don't have to make any decisions right away. But it's a good idea to start thinking about what options might be best for you and to discuss those with your healthcare team. Now let's do a quick review of what your options are. The first option we discussed in this presentation was kidney transplant. In transplantation, a kidney can come from a living donor or a deceased donor. Having a living donor will provide you with a kidney much faster than getting a kidney from a deceased donor through the deceased donor registry, which can take many years. Both you and your living donor can live healthy lives with one kidney. We also discussed several dialysis options in this presentation. As a quick summary, there are two basic kinds of dialysis, PD and hemo. For PD, you need a catheter in your belly, and you can do it manually during the day or using a machine at night. For hemodialysis, you need a fistula, which should be created in your arm long before you start dialysis. Hemo can be done on your own at home or in a dialysis clinic. Finally, in this presentation, we discussed the option of conservative care. This is when you choose not to do dialysis and not to have a kidney transplant when your kidneys start to fail. In this case, your medical care is focused on keeping you comfortable. Each of the options discussed in this presentation has its advantages and disadvantages. You will need to consider those carefully before making your decision about which is the best option for you. This can be difficult, but remember, you're not alone. If you have questions or concerns about your treatment options, don't hesitate to discuss them with your kidney care team. Your team is there to support you and help you choose the option that is best for you and your situation.